Welcome to our What I Wish I Knew series, where some of our more senior colleagues share advice or suggestions that they wish they would have learned earlier in their career. I'm Tiffany Sinclair, an endocrine and general surgeon with Kaiser in LA. I'm also the resident and associate society liaison to the Women in Surgery Committee. Today we have with us Dr. Jyoti Chohan to share her tips on billing and coding. Welcome.
Well, thank you. I just want to thank the ACS and the Women in Surgery Committee for allowing me to speak. I will be sharing some tips on what I wish I knew at the start of my career, which was how to be more savvy about billing and coding, which is a topic I think a lot of us rarely, if ever, get any information on during our medical training. So the first tip is or my recommendation is to purchase two resources. And the first one is called the American Medical Association Coding Professional Book. And this is a book that is put out and updated every year by the American Medical Association, and it has all of the Category 1 CPT procedural codes for all specialties. And where this might come in handy as a new surgeon or a more seasoned surgeon is it gives you a guide or a framework to understand what CPT procedure codes are available for your specialty. But what I think is even more important is it gives you a framework to understand what codes are available in other specialties that maybe cross over with some of the work that you do. So for instance, I'm a reconstructive urologist. And so while I use urology specific CPT codes regularly, I also frequently use plastics codes and abdominal codes that help me get the credit that I deserve for everything I do. The downside to this book is that it's just a list of codes, much like a telephone book, without any descriptors for the code. So the second resource really helps to flesh that out. And it is, again, published by the American Medical Association. It's updated yearly, and it's called the AMA Coding Essentials book. So this has several editions. And for instance, as a urologist, I could purchase the urology and nephrology book, but there's also cardiology and cardiothoracic surgery, general surgery and gastroenterology, and so on and so forth. And each of these editions gives you a succinct description of each code, so you know what steps would need to be done to get credit for that particular CPT. The second tip is to meet with your coding team and establish a strong relationship with them. And I always tell our residents that this is one of the most important relationships that you'll most likely have as a physician. And much of your RVU productivity and collections is really based on that relationship and their ability to interpret your documentation and again, give you all the credit you deserve. So establishing that relationship early can do three things. First, it can sort of help set the framework as a new surgeon for where to begin. They can give you a list of commonly used CPT codes for your specialty, a list of global periods for the surgeries you might commonly perform, and any maybe new documentation rules that could be applicable for you. The second thing that it does is it allows you both to review complex cases that you may not do very often together before that gets submitted to insurance. So what I found through our coding team is that they're a little unsure sometimes of how to code rare and complex surgeries. And through my review of these, I've oftentimes felt like I haven't gotten all the credit I've deserved due to their lack of certainty as to what's maybe going on and what procedural codes would fit that. So this helps to bridge the gap and again, make sure you're getting all the credit you deserve. And the last is it allows you to audit your practice and meet with them and maybe discuss discrepancies about what you are seeing and what you feel like maybe you should have gotten credit for. So the last tip is that you try to stay up to date with billing and coding. And I think like a lot of medicine, billing and coding is not static. And if you aren't aware of the changes, sometimes those significantly impact your, again, RVU productivity and collections, depending on how you're getting compensated. So the best way to try to stay up to date with as busy as we are is finding coding and billing lectures locally or through maybe state and national meetings and just listening in on either what has just happened or what may be coming down the pipeline. So for instance, in 2021, there were really large sweeping changes for outpatient documentation, billing, and coding. And starting January 2023, there are going to be really large changes on the inpatient side. So just an example of things that we need to be aware of and ways that we can try to stay in the know.
As a new surgeon in my first few years of practice, I definitely did not get a lot of info on billing and coding as a resident. So I need to take some notes on the resources that you shared with us today so I can stop Googling CPT codes, I think.
Well, I started out Googling also, and I think what I found was I wasn't able to get enough of the information I wanted to be sure that that code was correct, and then not being sure if that code I entered was the code that the coder was going to use. And so it sent me down a road of purchasing resources and creating relationships with the coding team that I found have made my practice almost more efficient, even though it did take a little bit of initial investment in time.
Thank you so much for joining us today and sharing your advice. We really enjoyed having you.